Hi my dear students, this is the third part of the lecture on respiratory system. In this lecture, we are going to learn about the mechanism of ventilation, that is, through the actions of the main muscles which are involved in breathing. And also, at the end of this lecture, we will discuss the disorders of the organs of respiratory system. The mechanism of breathing is called ventilation. The pulmonary ventilation is the act of breathing. It is the movement of air into and out of the lungs. Inflation and deflation of the lungs occur with each breath. Inflation is the expansion of the lungs. Deflation is the shrinkage of lungs. Breathing or ventilation occur in cycles of respiration. 12 to 15 cycles of respiration can be occur per minute. And a cycle of respiration is consists of three phases: inspiration, expiration, and pause. Inspiration is movement of air into the lungs. Expiration is movement of air out of lungs. The change of the volume of the chest during breathing occurs as a result of muscular activity. The main muscles involved in breathing are the intercostal muscles, the diaphragm, the muscles of abdominal wall, and muscles of the neck. The intercostal muscles are the muscles which occupy the spaces between two adjacent pairs of ribs. As we know, there are 12 pairs of ribs, therefore there are 11 pairs of intercostal muscles. These are arranged in two layers. The external layer is called the external intercostal muscles, and the internal layer is called the internal intercostal muscles. The diaphragm is a dome-shaped structure. It separates the thoracic and abdominal cavities by forming the floor of thoracic cavity and the roof of the abdominal cavity. When we are talking about the structure, it consists of a central tendon from which muscle fibers radiate to be attached to the lower ribs and sternum and to the vertebral column. This is a picture of diaphragm. You can see in the center, the whitish color part, it is the central tendon. And from the central tendon, you can see muscle fibers radiate or spread out. These muscle fibers goes and attach to lower ribs, sternum, and the vertebral column. When we are considering about the process of respiration, we can divide it into two main types, that is, normal or quiet breathing and difficult, forced or deep breathing. The muscles which are mainly contract during normal or quiet breathing are external intercostal muscles and the diaphragm. But during difficult breathing, they are assisted by other muscles such as internal intercostal muscles, neck, shoulder, and abdomen muscles. So now we are going to learn about the process of inspiration, or how the chest or the thoracic cavity expanded during inspiration. As we know, the first rib is fixed. Therefore, when the external intercostal muscles contract, they pull all the other ribs towards the first rib. The ribs are bucket shaped. Because of this shape, they move outwards as well as upwards. In this way, the thoracic cavity is enlarged antero-posteriorly as well as laterally. So, this picture will give you the idea how the volume of the thoracic cage increases during inspiration. When the external intercostal muscles contract, that you can see the ribs moves upwards towards the first rib. But due to its unique shape, the bucket shape, the ribs move upwards as well as outwards. Because of this, during inspiration, the volume of thoracic cage increases antero-posteriorly as well as laterally. This picture also gives you the idea how the anteroposterior expansion of thoracic cavity occurs due to this unique shape of rib that when it moves upward, it also moves outwards. And also you can see the lateral expansion of the thoracic cavity as well as the superior inferior expansion of the thoracic cavity. Let's see what happens to the diaphragm during process of inspiration. When the muscles of the diaphragm contracts, its muscle fibers shorten and the central tendon is pulled downwards. Because of this, the thoracic cavity enlarges in length. That means along the superior-inferior axis. The image in the left side shows you how the diaphragm goes downwards during inspiration, and because of that, superior-inferior expansion occurs in thoracic cavity. When we are considering the process of inspiration, it is the process that causes air to enter into lungs. During this process, simultaneous contraction of external intercostal muscles and the diaphragm occur. Because of this, the capacity of thoracic cavity increases in every side. As the thoracic cavity expands, the parietal pleura, which is attached to the internal side of the thoracic cavity, also moves with the walls of the thorax and the diaphragm. So, because of that, the visceral pleura also moves with the parietal pleura, and this leads the lungs to stretch and expand. So, as in this picture, you can see that parietal pleura is continuous with the visceral pleura. So, when the thoracic cage or the wall of the thoracic cage expanded, the parietal pleura also moved with it. As parietal pleura and visceral pleura are connected with each other, visceral pleura is also moved along with parietal pleura. So, visceral pleura is attached to the surface of the lungs. Therefore, lung wall is also expands with the visceral pleura. The increase in volume of the lungs lead to decreasing intra-alveolar or intrapulmonary pressure. This creates a pressure lower than atmospheric pressure. As a result, a pressure gradient is created. That is, the pressure inside the lungs is lower than atmospheric pressure. So because of that, air drives into lungs. This process of inspiration is an active process. That means it requires expenditure of energy for the muscle contraction. Now we will see the process of expiration. Expiration is the process that causes air to leave the lungs. During the process of expiration, the diaphragm and the external intercostal muscles become relaxed after inspiration. Because of this, the elasticity of the lung tissue causes the lungs to recoil or come to its normal state. With the lungs, the thoracic cavity wall also comes into its normal state. Because of this, the volume of the thoracic cavity as well as the volume of lungs decrease. As volumes goes down, the pressure inside the lungs goes up. Therefore, this leads the pressure inside the lungs exceed that of the atmosphere. So it created a pressure gradient and causes air to leave the lungs. The lungs still contain some air even after expiration. That is, in order to prevent the complete collapse of alveoli. This process is considered as passive because there is no muscle contraction occur in this process. Therefore, it do not require the expenditure of energy. After expiration, there is a pause before the next cycle begins. When we are considering breathing, there are different modes of breathing. Quiet breathing is the mode of breathing that occurs at rest. During quiet breathing, the diaphragm and the external intercostal muscles are contracted. Forced breathing is a mode of breathing that occurs during exercise or action. During forced breathing, inspiration and expiration both occur due to muscle contractions. Therefore, during forced breathing, inspiration and expiration both are active processes. In addition to contraction of the diaphragm and the external intercostal muscles, the internal intercostal muscles and the accessory muscles are contracted. The accessory muscles are the muscles of neck, muscles of shoulder, and muscles of abdominal wall. During forced inspiration, muscles of the neck also contract and lift the thoracic wall. This increases the lung volume than in quiet breathing. During forced expiration, accessory muscles of the abdomen also contract, which force the abdominal organs upwards against the diaphragm. This helps to push the diaphragm further into the thorax, pushing more air out. Other than that, during forced expiration, some internal intercostal muscles also compress the rib cage, which also reduce the volume of the thoracic cavity more than during quiet breathing. Now we are going to learn about the applied or clinical anatomy related to the respiratory tract. First, we are going to consider about the clinical anatomy of upper respiratory tract. Asthma is an inflammatory disease of the airways. Due to presence of some foreign particles in the airways, inflammatory processes can start. Because of that, the mucous membrane and the muscle layer of bronchi become thickened, and also the mucous glands are enlarged. Because of this, the airflow to the lower respiratory tract become reduced and breathing difficulties occur. Sinusitis is the inflammation of the nasal sinuses. Generally, it is caused by cold and wet climates. Atmospheric pollution, smoke, dust, overcrowding, dental infections, as well as some viral infections can also cause sinusitis. Otitis media is the inflammation of the middle ear. The bacteria from the back of the nose travel through the eustachian tube directly into the middle ear cavity and multiply in the fluid. The inflammation of the middle ear causes the eustachian tubes to close, causing the fluid to be trapped in the middle ear cavity. Because of that, hearing disturbance can result. Now we are going to consider about the infections of lower respiratory tract. Pneumonia is the inflammation of alveolar wall and the presence of fluid and pus in alveolar sacs. It is commonly caused by the bacterium called Streptococcus pneumoniae. Pulmonary emphysema is the reversible distension of the respiratory bronchioles, alveolar ducts, or alveoli. This reduces the surface area of the exchange of gas as well as the efficiency of gas exchange. Lung abscesses are most commonly caused by bacteria called Streptococcus. It causes local suppuration and necrosis within the lung substance. Suppuration is production of pus and necrosis is death of cells. Tuberculosis is another infection which can be seen in the lungs. It is also caused by a bacterium called Mycobacteria. As we know, the pleural cavity is filled with serous fluid. But when air or excess fluid enters the pleural cavity, the lung collapse can occur. The lung collapse is the shrinkage of lung. So you can see it in the picture. The lung collapse due to presence of air in the pleural cavity is called pneumothorax. The lung collapse due to presence of blood in the pleural cavity is called haemothorax. And the presence of excess fluid in the pleural cavity is called pleural effusion. Lung cancer is a malignant tumor which may develop due to uncontrolled cell division. Smoking is the main cause of lung cancer because tobacco smoke contains many carcinogens. Cancer cells from the lungs can sometimes spread to the other parts of the body through the lymphatic vessels. So this is the end of the lecture series on respiratory system.